your perspective on this whole process. Would you first just describe where your symptoms were, Makesh, when you were first dealing with them that ultimately brought you to see Rhad?
So the symptoms were started several years back. So initially there was like a lot of pain on my left leg, and after a point it became very difficult to even stand. So we tried initially. This was when 2000 maybe 15, probably around that time, 2015, or this is like 5 or 6 years back. So at that time, I tried several normal conservative approaches and things like that, and then it became very difficult, and so we had to do surgery. So it was a microdiscectomy, and once we did the surgery, the pain on the left leg completely went off, but there was still some pain on my right leg. So especially when I sit down, there used to be some pain on my after some time there used to be some kind of pain. And then the other issue was whenever I had to drive also, I used to get pain basically on the symptoms were more on the right leg now. So I was hoping with time it will go off, and then it kind of started reducing, but then after a point it started plateauing. And then after a point, suddenly there will be some kind of flare-ups once in a while. And then during the pandemic 2019, right, or 2019, there was like a more of a flare-up. And then at that point, I really felt like it is like 4 years, and since I didn't get complete relief, so I wanted to see if there is like a way to kind of completely fix this, or is it even solvable. um, so then I started consulting like orthopedic surgeons, and then did like a bunch of MRI, nerve conduction study, and so on. And looking at it, looking at the results of the MRI, it was not very conclusive. Most of them said don't do surgery, but then they all were also not sure like whether this would be permanent or that kind of a situation basically. And for me, the pain even started getting worse. Like sitting for 5 minutes or 10 minutes, the pain used to flare up a lot, largely on my right leg basically. So it is not really a back issue. It is more of a sciatica on the leg kind of
Sure.
issue. So back pain typically didn't have an issue. And so at that situation, I was looking for like a kind of a conservative approach to see if I could get relief. I mean, other than doing surgery, or like other things like nerve inject, like nerve block, that those, or like epidural, that kind of thing. So that kind of motivated me to try the McKenzie approach. But the reason to choose MDT versus others, that itself is a long story on why I kind of decided. So that's kind of like the rationale for coming towards MDT,
Yes.
basically. Yeah.
Yes. Okay. Very good. We'll get into some more. Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.